Yes, good afternoon to you all, to my MSc student, class of 2025-2026, academic section. I'll be introducing you to this very second semester course titled MLS 816, Advanced General Clinical Chemistry, to be taken by me, Dr. F.O. Oyakure. Yes, before trying to start this course, it is of interest for us to know the outline of what we'll be dealing with in this very second semester. I believe message has been sent across to all students to come back to campus for this very week for us to begin our lectures. Now, let's look at the outline in this very course. Number one outline talking about the general advanced courses in clinical chemistry and units. Here we'll be talking about some advanced instrumentation, which I believe we have idea as a result of our exposure to our place of work, training and retraining in some basic equipment pertaining to clinical chemistry. We also look at clinical chemistry unit, which we are familiar with, and we'll be playing with different units as regards to clinical chemistry. Then we are still going to look at carbohydrate metabolism. Here you already know what we are talking about. We'll be looking at how carbohydrates as one of the biomolecules is metabolized, and as well the clinical correlations from this very metabolism. Also look at the biochemistry of heme and iron, its importance, and also we look at the biochemistry of cancer, and we're also going to look at biochemistry of selected populations. There are various populations across. What do I mean? There is biochemistry of the neonate, biochemistry of the childhood, biochemistry of the adolescent, biochemistry of the critically ill, and so many, and what we are expected to know as masters of clinical chemistry. And not only that, we look at some basic instrumentation and separation method in regard to clinical chemistry. Yes, by way of introducing this very course, I just want us to see some of the objectives of what the course is all about. At the end of this very lesson, or this very course, as a master student of our great university, it is expected of you to know how carbohydrate is metabolized, various different pathways. You have to know the C10-6 and the breakdown of heme, and also to know and be able to explain the biochemistry of selected population in a real life world. And not just that, it is of interest also to know some of these very instruments we use in clinical chemistry, which we are familiar with, and also to understand the biochemistry of cancer. These are basic things that we are expected to know in this very course. Now let's move forward to lay foundation and give out some of the basic clinical chemistry focus. I think by fourth semester, some of this outline has been addressed in our courses. But first, it is of interest to recall what this subject matter is all about. As we say clinical chemistry, which is also clinical biochemistry, or what we popularly call the chemical pathology, is a branch of laboratory medicine that deals with principles of the principles of biochemistry in relation to disease diagnosis. Now, let me repeat that by saying that it is a branch of laboratory science that applied biochemical principles, physiological principles, statistical principles, and computational principles in disease diagnosis. Disease diagnosis, I believe you understand what we are talking about. Ability to be able to know the cause of that very disease. Ability for you to know the cause of a disease. Yes, it contains both your screening method and other aspect of disease diagnosis. Now let's look at monetary therapy. Monetary therapy, with the help of principle of biochemistry, you should be able to know how disease are being monitored, regularly using some drugs from day-to-day application. This is what I mean. As a clinical biochemist or as a chemical pathologist, when we are talking about drugs, we are looking at one, therapeutic effect, and also look at the overdose effect, which is the toxic effect. And not only that, take for example a patient that is diabetic, It is the work of the scientist, which is the medical laboratory scientists, especially the chemical pathology, should be able to bring out an accurate result that will help to manage the very patients on drugs. Yes, hyperglycemia. How many amounts of drug like of insulin, of metformin that will be needed based on their results in order to monitor the patient's treatment. Prognosis, you are checking what is the outcome of this disease. The outcome of the disease, which means for us to say a patient has a good prognosis, it all depends on your results and how the condition is being monitored. This is what clinical chemistry covers, and not only that, this is what clinical chemistry do in order to ensure patient has a good outcome from diagnostic procedure. Now, to push it further, in clinical chemistry there are some key topics that have been treated aforetime. Let me mention some few. I believe in first semester or this very semester they have a lecture will be on advanced clinical chemistry, which focuses on molecular mechanism of disease, enzymology, and not only that, metabolic disorders, instrumentation. Now, another key aspect is endocrinology, which I believe is going to center more on one of your courses this very semester on endocrinology, which will be taken by one of the Professor M.F. Olaniyan. Now it's going to center his talk on endocrine and metabolic biochemistry. Now, there are other branches of clinical biochemistry, which talks about molecular biology, clinical molecular biology. There it focuses on DNA, RNA analysis, PCR, whether it is real time or conventional, talks about mutation and biomarker discoveries and how it applies to treatment of cancer. Then another branch that we will look into is toxicology, which I believe one of the prof is going to take on toxicology and therapeutic. Here we talk about drugs and poisonings, how drugs are being metabolized using the pharmacokinetics and the pharmacodynamics of pharmacology. Yes, talking about drug absorption, drug metabolism, drug elimination, and also drug distribution. These are what we refer to as admin in pharmacology and as well in toxicology. That is another key aspect of clinical chemistry that you are going to focus on this very semester. Another area is going to talk about clinical metabolism, micromolecules like carbohydrate, lipids, protein, and nucleic acid. Then we also look at immunochemistries, which has already been dealt with by our prof in last semester. Then last semester, you guys also look at management system, quality management system, and also we are going to look at instrumentation in clinical chemistry this very semester, looking at spectrophotometry, chromatography, electrophoresis, and mass spectrometry. These are some of the covers, some of the areas we are going to focus on this very semester. Let me welcome you to this very course. The titled Advanced Clinical Chemistry, MLS 816. Thank you. Please, this very semester is my first time that I'll be interfacing with you. Please, I haven't given you what the course outline is all about. I expect every one of us to go in depth by developing our lexing notes. I'm the type at this very level is to guide you, not giving you any lexing notes. I will guide, explain some basic things, then we rapport, we talk, you ask question, I reply, and flow together. But I want you to go back and develop your notes, your lecture notes, based on the understanding we are going to interface with in coming days in this very semester. Thank you.